for Gnosis team, and very excited to announce you that we are very thankful to Gnosis for starting RBT activities in Mumbai. Let us start with the salutation to Lord Patanjali with the prayer, and then we will start the today's meeting. If you know the prayer, please join with us. Otherwise, just enjoy the sound. 3 times sound of God, sound of universe, sound of you, sound of Om. Yogena chittasya padena vacham malam sarirasya cha vedyakena yopa karotam pravaram munina patanjalim pranjaliranatosmi abahu purushakaram sankhachakra sidharinam Sahasra Sirsam Svetam Pranamami Patanjali. Om Sehna Vavatu Sehnau Bhunaktu Sahaviryam Karvavahai Tejasvina Vadhitamastu Ma Vidvishavahai. Om Shanti Shanti Shanti. Hari Om. Thank you everyone for a wonderful evening, and hope we will have a wonderful session. A lot of people, senior people I know, they have joined the program. I request Vineeta to give the little introduction about the Prana Yoga Therapy Center, which is instrumental in starting the RBT activity in Mumbai. Yes, Vineeta.
Yes, thank you, sir. So namaste everyone. Once again, a very warm welcome to everyone present here. This is an orientation on the Rope and Bell Therapy course, which is an advanced medical yoga course conducted by Gnosis Medical Yoga Foundation in association with Prana Yoga Therapy Center for participants based in Mumbai. Okay, so now I'll give you a little brief about Prana Yoga Therapy Center. Now, Prana Yoga Therapy Center has been started by our founder, Dr. Ghanshyam Sharma sir, and his wife, the co-founder, Dr. Preeti Sharma. Now, we'll move to an introduction about sir. So he's the founder, as I just said. He's got his MD from the University of Bombay. He's also a yoga therapist, certified in 1993 from Kevalya Dham. So he's been practicing since like a good many years. He's also IIYT certified yoga therapist and is an honorary medical yoga consultant with Kevalya Dham. Also a senior Shivananda yoga teacher, faculty at Shivananda Yoga Vedanta Ashram, India and in Vietnam, and the lead yoga examiner for a lot of examination bodies like TQ Cert Yoga Mudra and New Age Yoga Institute. Now we'll move to Dr. Preeti Sharma, an introduction about her. She is the co-founder of Prana Yoga Therapy Center. She is an Ayurvedic doctor and also a yoga therapist from Kevalya Dham. She is also an expert in Dankil Yoga, and she's also had over 30 years of experience in prenatal and postnatal yoga and PCOS. So she's conducted several workshops and certificate courses, such as the Yoga Health Educator program, and these have been really successful over a period of time. Now, lucky for me, I've had the opportunity to work with both of them, and we are honestly and truly blessed. And anyone who is part of the Prana Yoga team will tell you the same thing. We are absolutely privileged to be working with Ghanshyam sir and Preeti ma'am. They are an absolute delight to work with, always there for us as mentors, always there to support us, and we're like one big family. Okay, so now I'll just take you through a few courses that we offer at Prana Yoga Therapy Center. So some of them are the YCB affiliated courses, which is the teacher's training course, where we offer level 1, 2, 3, and 4. We also have therapy courses. So we have the yoga therapist course and the therapeutic yoga consultant course. Now we also have special courses and offerings, some of which are the Yoga Health Educator Certificate course in pregnancy and PCOS, Dunkle Yoga. Very often through the year and at different points in time, we have a lecture series on various topics. Okay, now these topics range from women's health to Ayurveda to therapy, to yoga as therapy, and associating yoga with the medical practice. So we have lecture series on different topics throughout the year. Also, we have a special teacher's training course for doctors and medical practitioners. Now, apart from this, if you feel you want to just attend a yoga class and stay fit and fine, we have yoga for all age groups of people and for both genders in the mornings. Okay, apart from that, we have yoga for women. Since they get very little time juggling so many responsibilities that they have, we have a separate group and a special group for women in the evenings. And we also have yoga for persons with low vision and blindness. And of late, we've also got them to be included in the regular batches. So we all have a practice in the morning together. And it's a beautiful session. So for those who can ever join, feel free to join it. All right, so that's all about us. And now we will...
Edita requests to give little information about Dunkle Yoga.
Okay, so we have yoga for persons with low vision and blindness. Okay, and this was a program that we started during the lockdown in 2021. And it's been a very successful program. So we started off with a few participants, and we have these programs spread across, whether they are personalized sessions, semi-personalized, or group sessions. We've had trainers from across the world. So we've had yoga therapists participating from across the world. We've also had participants, persons with low vision and blindness, who've come from across the globe. So it's been a very successful program, and the numbers have only increased over a period of time. So anyone who's been part of it will tell you that they absolutely love the experience, be it a participant or also the trainer. Okay, so we've had this, and now, as I said, they've also been included into our groups. So we have a very diverse group of participants practicing yoga early morning every day, and it's really nice to see. So do join in.
Thank you, Edita. I request Dr. Kaval now, Dr. Kaval Madan from Gnosis to give information about the Gnosis Yoga Foundation.
Good evening, everyone. Namaste to all. I myself, Dr. Kaval. I'm a faculty teacher at Gnosis Medical Yoga. So Gnosis means spiritual knowledge. Founder of our institute is Dr. Vineeta Ketkar ma'am. She is a practicing family physician in Pune for last 40 years. We at Gnosis offers with yogic health service and yoga teacher training programs at well-equipped Yoga Institute at Pune since 2006. Gnosis Medical Yoga is a confluence of modern medicine and ancient yogic science. We work under two domains. One is educational and second is clinical domain. In educational domain, we conduct certified courses like Medical Yoga Teacher Training course, which is a basic course for beginners. The course syllabus consists of human anatomy, human physiology, and selective skeletal muscles are taught which are used in yogic posture practice. Second is Advanced Medical Yoga course for yoga professionals. This course updates for medical knowledge which are related to various disease and disorders. This enhances their yoga professional activity in today's Google-friendly society. And same course is useful for practicing doctors because it orients them in yogic science. This adds value to their clinical practice and it is very much appreciated by patients. Now we prepare patients' case paper. We advise individualized programs to them. Recently, Ketkar ma'am has published 3 books. First book is Ashtanga Yoga and Modern Medicine. Second book is Rope and Belt Therapy book for knee osteoarthritis. Third book is Rope and Belt Therapy for spondylosis and disc disease. At present, we are collecting data in trial and control cases for rope and belt therapy. The ethical committee for BJ Medical College has given the permission for it. With this introduction of Gnosis, I really feel very proud to be part of Gnosis. Ketkar ma'am is always very kind, supportive, encouraging to us every time. She's there to help us. We are looking forward for pleasant association with Dr. Ghansham Sharma ji, who has taken the battle of RBT, that is rope and belt therapy, in Mumbai. And I'm really very happy to share Gnosis has reached Mumbai in serving the society. Let us give a big hand to Dr. Ghansham Sharma ji. Thank you, everyone.
Thank you, Dr. Kawal. Thank you very much. My pleasure to welcome Dr. Vineeta Ketkar ji. Madam, thank you very much for spending your valuable time for this orientation seminar, specially organized for the Mumbai participants. See, there are a few things which are mentioned, but there are few things which are not mentioned. For example, above all her qualifications and degrees and experience, it is my pleasure to say that Dr. Vineeta Ketkar is a wonderful teacher. She is a wonderful teacher because that is her teaching ability. I have seen when I did my medical RBT course at the Gnosis online. But I have to mention something about what her experience is. She is a very dedicated family musician, qualified, graduated, medically graduated from Mumbai, but later on shifted to Pune, practicing modern medicines, hardcore. This is, Madam uses the word. She is a hardcore modern medicines. Means anything, if you see the modern medicines, look from the analytical point of view. It is not any subjective. Yoga is a subjective and modern medicine is a objective. Now it is very difficult to merge both the sciences together, which she is doing wonderfully. So she did her medicine practicing as a family physician from 1981. Our important focus in practice is counseling and the careful judicial use of the medicines with yogic awareness. Strongly believes in doctor helps to heal. Very like Dr. Athavale used to write on his prescription paper, I treat, he cures. So like this, Madam is Dr. Ji is a student of Iyengar Yoga Institute, Pune for 10 years, studied RBT under Dr. Srikant Karandikar ji for 14 years. Wonderful. Worked independently at Hardikar Hospital, Pune in 2006. And I think Unnati started from 2008 onwards, correct? She is a founder trustee of Gnosis Medical Yoga Foundation. A recent publication, as mentioned by Dr. Kawal, is basically Ashtanga Yoga, Yoga for Arthritis and Yoga for Spondylosis. These are her. Her clinic is there at Pune, Alandi Road, Unnati Yoga Therapy Center at Shivaji Nagar, and one more Gayatri Yoga Training Center in Pune. These 3 wonderful activities there. Yeah. So with this introduction, I request Madam that we have this talk show, not like a seminar. So I will ask, there are a lot of questions I'm getting from the participants, and these all questions I have synchronized and will ask you. So basically they are not my questions, they are questions from the last 10-15 days, whatever the questions we have received. So first thing we get the question, what is this RBT? This is the first question we get from all the participants. We have learned ropes, we have learned belt, but we have not learned some terms like RBT and how it is a part of yoga therapy.
Yes. Thank you, Ganesham-ji, for such a wonderful orientation program, because we are conducting courses from 2006, but so far we have never conducted any orientation program. So in this approach, you are my teacher. So we are going to learn lot many things, Kaval, me, Ketkar, and all of my team from you, how to be a very professional and very methodical. So thank you for giving us the opportunity to present our work. Now, before I start saying something about RBT, I will like to express my deep gratitude towards B.K. Iyengar Guruji, who started the use of ropes and belts in yogic practices. Before that, nobody has done it. So it is his pioneering efforts right from 1970 onwards. And this was in enhancing the effects of yogic postures, how to use ropes and belts, because we all know we are having many stiffnesses in our body at skeletal level, forget about mind level, and he has tried to use ropes and belts. Dr. S.V. Karandikar, Shrikanta Vishwanath Karandikar, an ardent student of Iyengar Guruji, who was going to institute for almost 12 years, further enhanced and formulated rope and belt therapy, what we are going to introduce today, because he was a practicing modern medicine doctor, MBBS from Bizay Medical College. He was practicing in Narayanpet. So, but natural with a high clinical acumen and constantly being with Guruji and visiting all over world with Guruji and demonstrating various postures, that chemistry has come out with applications so as to treat patients' illnesses with the help of ropes and belts. And in this journey, he had conducted a 3 years Tivra Samvegi course for us at Kabirbagh. It was conducted for 3 years, and he used to teach us non-stop for 3 hours once in a week on Thursday. He used to start sharp at 6 o'clock and complete at 9 o'clock. So 3 hours non-stop teaching we have enjoyed. And it was like a shower of pearls. He never has done any spoon feeding to us. He just used to shower the pearls on us. Whatever pearls you catch and go ahead with it. That's what he used to say. Be a blotting paper. Whatever you will absorb, it is all yours. So with this, my deep gratitude towards Iyengar Guruji, Dr. S.V. Karandikar, and the third most important person in my life is Dr. Hardikar sir, the eminent orthopedic surgeon of Pune, Dr. Senior Hardikar sir, that's what we call him. He's a father figure in front of me because he gave us the opportunity to start our independent work in Pune way back in 2006. And that happened because he had visited Kabirbagh to meet Dr. S.V. Karandikar, and he accepted him as a yogic scientist. And he knew what he is doing and how he is applying his clinical acumen. And that's why the doors of Hardikar Hospital were open to us. And we enjoyed all the freedom, all the support with him for 5 years. And eventually we got independently settled in the present premises. So with my deep gratitude, let me say now what is this rope and belt therapy. This rope and belt therapy is designed by Dr. Karandikar with a base of yogic postures. So whatever formulations are given, for example, knee osteoarthritis, or for lumbar spondylosis, or for cervical spondylosis, are all based on yogic postures. To give you an example, whenever a patient sits for the rope and belt therapy on bench, we never make them sit on the floor, but naturally it is not indicated to sit on the floor. The patient sits in Dandasana. So the journey starts right there, that if we are practicing Dandasana, what are the instructions we give to the person? And you can just visualize and imagine the instructions, that there should be shoulder distance between your feet, toes towards you, heels away from you. Keep your foot at 90 degree, that is 90 degree dorsiflexion. Tighten your kneecap. Sit straight, hands below your shoulder joint. This whole alignment which we are teaching the person who is not suffering from knee pain, if same instructions are to be done or the effects are to be given to the patient to heal his pain or her pain, we need to use ropes and belts so that we can correct the arches, that is at foot. We can correct the ankle position, again with the help of ropes and belts. We can work on his quadriceps and hamstrings and eventually on hip joint and lumbar spine. So the instructions which are given in Dandasana, he just converted into rope and belt arrangement so as to lead to passive correction. So rope and belt therapy is aiming initially at passive correction, and this passive correction help the patient to get relief from pain and of course enjoy the mobility because the stiffness also reduces. So this is all about rope and belt therapy, and that way we can explain each and every corrective posture which is given with rope and belt is basically based on a classical yogic posture. And why it is called rope and belt? It is a simple name I have given so that there will not be any clashes of any interest with anybody. We are using rope and belt, and that's why the therapy which is based with the use of rope and belt is rope and belt therapy, RBT. So simple. Yes.
Okay, thank you, madam. Second very common question comes that in which cases this therapy is successful or giving good results? All
Yes.
the cases or any specifically system-oriented cases?
Yes, when we are talking about rope and belt therapy, it is specifically indicated for osteoarthritis of knee joint and spondylosis and disc disease. And when we say spondylosis, it is cervical spondylosis and lumbar spondylosis. When we say spondylosis, it is affecting the intervertebral joint or the vertebral column. And when we say disc disease, it is the prolapsed intervertebral disc or the herniated disc. So this therapy is specifically indicated for only these two conditions, osteoarthritis of knee joint and spondylosis. And everybody just wonders that if it is indicated for only two indications, how can it be significant? And as you all know, it is significant because osteoarthritis of knee joint is a fate of everybody. Eventually, it may be a fate in my case as well, because both of them, spondylosis and osteoarthritis, are degenerative conditions occurring because of use and age. So eventually everybody is going to land up in those conditions. Now for spondylosis, the tender age of 25, 30, up to 30, even the young people are suffering because of our prolonged sitting and prolonged traveling, sitting in a one place, and almost age is no bar now for spondylosis. At least for osteoarthritis, I can say there is an age bar, but for spondylosis, there is no age limit. At a very younger age, everybody is suffering. So even if the indications are two, rope and belt therapy is indicated almost for every home. Now in that case, for osteoarthritis of knee joint, every Indian cannot afford total knee replacement eventually. Number one. And number two, we have to prevent it. We have to delay it. As far as spondylosis is concerned, we have to prevent it. And for osteoarthritis, we have to delay it as much as possible. So believe me, this is indicated for these two conditions. In addition, we can help the cases of ankylosing spondylitis as well. Because as you all know, there is no medicine for ankylosing spondylitis. The whole shoulder girdle and pelvic girdle becomes so stiff along with involvement of SI joint, that is sacroiliac joint, the person becomes miserable. There's a little help we can offer in this case as well. But main two pillars are osteoarthritis of knee joint and spondylosis.
Thank you. Madam, in last 1 month, whatever the knee x-rays I have seen, many times patient comes to us. He tells us that I am having arthritis. But when you see the x-ray, there is no arthritis. So arthritis has become like a phobia.
Yes.
A phobia कि last when we saw and had a online interaction with you, you said your knee is absolutely fine.
Yes.
But patient comes कि I have suffered a arthritis. So rather than arthritis, we can simply call knee pain.
Yes.
Knee
Very
pain.
good.
But many times what happens कि already the transferred effect is there. That I got arthritis, but when you see the X-ray, that is what is emphasis. We any RBT case we take only after looking at the X-ray.
Yes.
X-ray is absolutely fine. So this is what I have seen in last few X-rays which I have shared and worked with you. Okay, other common perception comes. Is it a physiotherapy? Many times when you see RBT, a common perception, a layman perception is, then how can you call it is a yoga therapy? So this is another very frequent question comes, is it a physiotherapy or yoga therapy?
Correct. This question I faced in 2008 when I presented a paper at Kaivaladam International Conference. And the person who was assessing, the senior person, he just stood up and said, where is yoga therapy? Where is yoga in this? Or whatever you are showing is just physiotherapy. And I had tough time since then. But slowly this question took a backseat. But today Ghanshyamji has again revived my memories of answering this question. And to answer this question, that why we say this is yoga therapy, offshoot of yoga therapy, or as Dr. Ramesh Bijlani has said, it is an innovative approach in yogic health science because it is based, one is on classical yogic postures. Second, though initiated by rope and belt therapy, so as to give passive results to the patient for relief of pain and stiffness, eventually patient, and using the ambulatory belts also, eventually patient has to understand how to correct his or her body. So we formulate rope and belt therapy program under 3 headings. One is at-home yogic postures, which are modified to give results to the patient for palliation, that is symptom reduction. And second is to delay the course of the disease or disorder. So these yogic postures are taught to patients, number 1. Number 2 is ambulatory belts to be used in day-to-day practice. And number 3 is rope and belt therapy, which gives a passive correction. But this is yoga because yoga, we all know, is a science of awareness. So the moment we say the science of awareness, it becomes a very educative program. And that's why all our Gnosis team have the whole team, all team members have to talk a lot because we have to give basic education of how to stand, how to walk, how to sit, and how to keep your shoulder girdle and pelvic girdle in a right position. Where should be the stretching? Where should be the strengthening? How is the alignment? So the whole program is designed on an education base. Patient has to learn, remember, follow the instructions, which increase the awareness in case of patients, and hence it becomes a yogic science. In addition to correction of musculoskeletal complaints, we have to attend patient's mind. Attending patient's mind by making him or her work on deep conscious breathing is the fundamental part of the yogic protocol. So last 10 minutes are dedicated for conscious deep breathing, where the patient's mind's agitation is reduced and there is a help to heal. And there are many aspects because when we say yoga, we always say Ashtanga yoga. And that's why rope and belt therapy, though appears as a mechanical correction, of course it is a mechanical correction, but the mechanical correction is very educative and based on developing the awareness and maintaining it.
Okay, madam, you are a doctor. You have worked with Dr. Karandikar ji, Hardikar ji. But how do you feel that this course will be useful for a simple yoga teacher or a yoga therapist? how this course will be useful them professionally.
Yes. For that matter, we have, for answering this question, we have invited two of our teachers. Can they answer them, Ganesham ji?
Yeah, sure. We
Yes.
have two teachers, Shilpa ji and Abhishek ji.
Correct. So,
Okay. Okay.
Shilpa ji can answer this question. How this rope and belt therapy approach has helped her to set her center, because she has started her own center and she was working there and handling patients independently. Let me introduce Shilpa. She is our accountant at Gnosis. So all finance she is conducting. She is a very responsible and very, what I should say, important, significant person in our life, day-to-day life, because she has to authorize many things. She is our yoga teacher student, medical yoga therapy student, and she has done YCB 1, 2, and 3. And presently she is doing MA in yoga. And now she is going to attend the international conference at Dubai in this month end, where she will be representing a paper on rope and belt therapy. So mic goes in Shilpa's hand now.
Yes, thank you, ma'am. Hello, everyone. I'm Shilpa. I have done my medical yoga therapy course in 2017, November 2017. And since then, immediately after the course, I have started my center, and I have started doing my own practice. As the course was so educative, so informative, immediately after the course, I have started my practice. I start my practice. As though I am non-medico, but it was not difficult for me to deal with the patient, as the course was really very educative, and the help we needed, we used to get timely from doctors and our colleagues or seniors. We used to get help, and so our confidence started boosting up, and so patients are also coming to us, because because one patient is getting cured, or if his or her pain is relieved, then he definitely will tell someone else, and he or she also will come to us. That is the main thing. And so patients are getting cured, painkillers are reduced, medicines are reduced, and so patients are happy and they used to come to us. And again, we are getting guidance still if you need. And we are independently able to deal with the patients. We are able to know what has happened to patients. We can read the X-ray, we can read the report, and we are able to know what has happened to patients. Even cases like if you are having osteoarthritis of knee, and with that, some other cases are there, or other pathy is there. If so we are able to know that, and we can treat people. We are able to know mind of the patient, we are able to know the body of patient, and so we are treating people, and people are happy. They are relieved from their pain, and this therapy is really very helpful for patients. And though I am non-medico, I am able to treat people. So that is the most important thing for me, because I do not know M from the medicine. So though because my background is commerce background, but I did this course, and I'm really very happy that I'm able to know many things about medical. And so because from that course, I am helping even my family. Few of my family members are getting some problems, and I'm helping them. So that is also very helpful for me. So for my personal thing, it is also very helpful, and for treating people, it is also very helpful. So
thank you, Shilpa.
I can say yes, ma'am. Thank you so much.
Thank you, Shilpa ji. Is Abhishek ji is available? Abhishek ji?
Is Abhishek there?
Namaskar.
Yeah. Yes.
Hello, Namaskar.
Yeah.
So let me introduce Abhishek. Abhishek
Yes.
is a senior yoga therapist at Gnosis Medical Yoga, and he is the only male member. Although I don't know how he faces all of us, we are all females, so he is only a male. So a very brave person, and a person with lot of patience. And he's been attending the patients for many years now, must be 5 to 6 years. And many patients come only in his time, because they say that, no, we want Abhishek sir to attend us. So there is a jadoo in his hand, and he has mastered this technique of rope and belt therapy, understands patient's mind, the severity, and let us hear from him how it has benefited him for his work at Gnosis as well as his individual practice. Yes, Abhishek.
येस मॅम, थँक्यू. माझे नाव अभिषेक सुभाष देशमुख. सध्या उन्नती म्हणजेच जिनॉसिस मेडिकल योगा सेंटर पुणे येथे ऍज अ योगा इन्स्ट्रक्टर आणि योगा थेरपिस्ट म्हणून कार्यरत आहे. वर्ष 2016 मध्ये मी पुण्याच्या एका संस्थेमधून मी एक योगा टीचरचा बेसिक कोर्स कंप्लीट केला. परंतु मनातून नेहमीच वाटत होते की आपल्यासाठी एवढेसे पुरेसे नाही. म्हणून स्वतःच्या प्रॅक्टिससाठी पुण्याच्या मॉडेल कॉलनीतील अयंगार इन्स्टिट्यूट मध्ये प्रवेश केला आणि तिथे बिगिनर 1 to इंटरमिजिएट 1 to अशी प्रॅक्टिस करीत राहिलो मी. परंतु नुसती आसने करणे म्हणजेच अंग वळवणे नव्हे, तर त्याचा अंतर्गत आणि बहिर्गत शरीरावर काय परिणाम होतो हे माहीत असणे गरजेचे आहे. त्यासाठी आपल्याला शरीरशास्त्र म्हणजे फिजिओलॉजी अनॅटॉमी माहीत असते अत्यंत महत्वाचं आहे. त्यासाठी मग मी पुन्हा अशा संस्थेची की जिथे अशा प्रकारचे शिक्षण मिळेल अशा संस्था सर्च करत राहिलो आणि मग एका ठिकाणाहून मला जिनॉसिस मेडिकल योगा इन्स्टिट्यूटची माहिती मिळाली. नोव्हेंबर.
अभिषेक हिंदीत बोलू शकशील? रिक्वेस्ट येते हिंदीत बोल म्हणून. ट्राय कोशिश कीजिए.
अच्छा, ठीक है.
अभिषेक कुछ दिक्कत हुई तो हम आपको हेल्प करेंगे, डोंट वरी.
ओके सर, ओके सर, ओके. सर क्या नवंबर 2017 से मार्च 2018 इन 4 months के लिए मैंने जिनॉसिस मेडिकल योगा से एडवांस मेडिकल योगा टीचर कोर्स ज्वाइन किया. इसमें आरबीटी मॉड्यूल इंक्लूड था 2 महीने के लिए. ये कोर्स सीखते वक्त मेरे को पेशेंट के एक्सरे और एमआरआई रिपोर्ट्स और पेशेंट की केस हिस्ट्री रीड करने की प्रैक्टिस हुई थी. इससे पेशेंट के पोस्चर करेक्ट करने के लिए एम्बुलेटरी बेल्ट का मुझे हेल्प हुई. इसमें पेल्विक लिप बेल्ट, बीएसडी, काफ स्ट्रेच बेल्ट, इसका भी बहुत मुझे हेल्प हुई. ये सब सीखते वक्त मुझे एज अ पर्सनल ट्रेनर में फिटनेस बैच के लिए आउट ऑफ जा रहा था. बट इसमें मुझे ऐसे फील हो रहा था कि ये सब करते समय कि मेडिकल इशू यानी कि सर्वाइकल, लंबर स्पॉन्डिलोसिस, नी, ऐसे बहुत से पेशेंट है. इसके लिए ये रोप बेल्ट थेरेपी का मुझे बहुत मदद हो गई. इसमें फ्रोजन शोल्डर, एंकोलॉजिंग स्पॉन्डिलोसिस, पैरालिसिस, इसमें ऐसे पेशेंट ट्रीट करते समय मुझे ये आरबीटी का बहुत हेल्प हुई. और लोगों से मेरे को पॉजिटिव रिस्पांस भी आने लगा, फीडबैक आने लगा इसकी वजह से.
थैंक यू अभिषेक. अच्छा, मुझे बताइए, मैडम ने बताया कि आपके हाथ में जादू है, तो ये जादू क्या है?
सर ये बहुत प्रैक्टिस करने के बाद ये मुझे जम रहा है.
अच्छा, थैंक यू अभिषेक.
ओके सर,
वेरी गुड अभिषेक.
थैंक यू.
यस.
अच्छा मैडम, अभी मुझे बताइए कि कोई पेशेंट्स का भी हम ओपिनियन देख सकते हैं क्या? इज इट पॉसिबल टू सी सम पेशेंट्स इंटरेक्शन?
Yeah, so let me see. Mrs. Karandikar is there.
Kajale is there, Kajale ji.
And Dr. Kajale.
Kajale.
Yeah, so Dr. Kajale will give his experience regarding the RBT. Dr. Kajale. Before he starts, I will brief him about. He is Dr. Mukunda Kajale. He is a PhD in archaeology, and I think he came to Hardikar Hospital. That is about 12, 13, 14 years ago, and he was complaining of little knee pain, and the X-ray was showing severe osteoarthritis. And this fellow was trekking here and there. He was going to archaeology excavations and he was moving too much and he was complaining of knee pain, were showing severe osteoarthritis. It was all a very much a funny situation. But Dr. Mukunda Kajale has so much of patience and perseverance and positivity that he started taking RBT, and let us hear from him now. Sir.
Good evening, Dr. Mrs. Ketkar, Madam, and also the organizers of this meeting. I just joined you, but I do not have the previous background. Anyway, I would be very happy to share my personal experiences. See, I was detected with medium to severe osteoarthritis. That was on 4th November 2010. I remember the exact date also.
Oh my God.
This was with the help of course, the X-rays and various complaints, and this was done by a very famous orthopedician from Pune. So there was absolutely no doubt about it. This was about almost more than 11 years ago, and then in 2011, that was June 2011, I was also detected with
Listhesis.
the anterior listhesis, that was L5 over S1. So this actually, these two diagnoses, I mean, really put me down. And I was just wondering how this could happen to me. I have been so active. I have been, say, moving around. My lifestyle was good, but then this was to happen, and it happened. And then, of course, I was under the treatment of a team of orthopedicians, and they were discussing, I mean, what is actually to be done with this patient, because he has both the lower back problem as well as the knee problem. And they were discussing which one, because they were convinced that this man needs an operation because of the looking at the various parameters which they had judged, and rightly so. I mean, but then I was not in a mood to undergo operation, because this was a great shock for me, and I said, no, I must do something else. And then incidentally, by God's grace, I came across a small advertisement in a local newspaper regarding the medical yoga therapy. I was already a student of yoga, and I used to do, I was in a very famous institution where I learned yoga. So, but I said that now let me give a try to yoga therapy and see whether this can help me to overcome the problem. So I landed up in Hardikar Hospital under the care of Dr. Mrs. Ketkar. She was extremely kind, and she gave me a lot of courage, and they gave me a sort of encouragement to try medical yoga therapy. In first two sessions itself, I felt very happy, and I said I also joined a course which was being conducted by her, especially for doctors. She was kind enough to give me admission for this. So I learned many things about the knee osteoarthritis, as well as I learned something about the lower back problem, especially the spondylolysis as well as spondylolisthesis, and how all these things are interrelated. All this had resulted in my poor posture. And I said, the yoga therapy, she gave me an assurance that yoga therapy can help me to manage my symptoms. And it really worked wonders, I must say. I must admit it. Because the orthopedicians were of the opinion that I might have to go operation at any time, probably either because of my anterior listhesis, which was first degree to second degree level. So I was quite nervous also, but she gave me a lot of courage, and I tried both the therapy for the knees as well as therapy for my lower back problem, and also the various other small issues, musculoskeletal issues. So I did the therapy as advised by her, and also by her wonderful colleagues at the Unnati Yoga Center, which was then located in the Hardikar Hospital. So I also did some exercises as per her advice, as per their advice, rather, I must say, and also joined the course, which helped me to understand my own conditions much in a better way. So I must tell you that I'm very happy to inform you that I could postpone my both the operations, knee operation as well as knee osteoarthritis, knee TKR, as well as my operation for the listhesis problem. So I am able to, I remember I used to be taking 2 to 3 painkillers every day. But within 2-3 months time, my painkiller dosage reduced from 2 to 3 to 1. And then after a year or so, I was free from all the painkiller medications. So this helped me to undertake my passion to an extent that I said, okay, I will learn more and more about these things, and I kept learning, and I have been able to postpone my operation, and now I have almost forgotten about it. So I'm sure. I mean, I do have some musculoskeletal problems. I don't deny it, but they are fairly well managed. I have some friends who were also doing a lot of running with me, and they were doctors. They were MBBS doctors, and they were also in a way my teachers. But my teacher friend, who was doing running and also trekking and other things with me, he also suffered from the osteoarthritis, and he, despite being a doctor, he chose to undergo TKR, and of course his lifestyle is improved. But my lifestyle has improved even without TKR.
Very good.
So I would like to tell all the listeners in this gathering that first of all, please give due consideration to non-surgical approaches, and especially the rope and belt therapy. I have been using rope and belt therapy. I have been traveling also. I traveled abroad using the pelvic belt and also the calf belts and various other things. I used to carry it with me, and this has never deterred me from my own missions, my own passions. So I am requesting all the participants of this meeting that please do try RBT before giving opting for choice of, say, any kind of operations. Thank you very much for allowing me to share my experiences with the rope and belt therapy, and also with the Unnati Yoga Center, all the wonderful colleagues and wonderful trainers at the Yoga Institute, Yoga Center for last 10 to 12 years. Thank you very much indeed.
Mukundji, some participants are very much interested to know how young you are.
Thank you so much. See, the age is
just a number.
Just a number. So,
but before Kajaleji stops, I will have to mention one thing. It was not our efforts, but it is Dr. Mukunda Kajale is coming to Institute for last 11 years, and that is not a joke. He is coming to Institute for 11 years just for maintenance, just for servicing his knee joint and servicing the spine. I mean, it is not possible for everybody to come, but this kind of perseverance he has shown, and he is enjoying the results. And why people don't come to our center, in spite of this being useful, why they don't come to our center is because this is a long pathway. Yoga is not a shortcut, it is a long pathway. And people like Dr. Kajale only can give justice to this pathway because he has a lot of patience, perseverance, and self-help. Because he is helping his own body, we are just helping him. So that kind of approach, let us learn from Dr. Mukunda Kajale and see the wonders. And somebody was asking whether his problems are cured. Let me see that he was constantly saying that he has managed to postpone the surgeries. So it is not a cure, but we are offering a care. a care to minimize the pain and stiffness and to be functionally fit and avoiding the pain relieving medicines totally. And surgeons also don't operate unless and until you complain of pain. So patients go to orthopedic surgeon, patient goes to a spine surgeon, and they have to do surgery because you are constantly complaining of pain. Please believe me, I have attended many lectures of orthopedic surgeons, many lectures of spine surgeons. They say if patient says that pain, pain and pain, uncontrolled pain, and I don't want to take pain relieving medicines, then only they advise surgery. But if you can manage with your own efforts and rope and belt therapy, no surgeon will operate on you. So thank you, Dr. Mukunda Kajales. Thank you. Thank
Just
you.
one second, I will just take. As madam has already pointed out, yoga is not a magic. Yoga is it works only with consistency. Shane shane, puna puna. This is the key in yoga and also in yoga therapy. So I think thank you so much. Thank you so much.
Yes, yes.
Thank you, Dr. Kajale ji, very much. Wonderful, very inspirational experience.
Thank you, sir. Thank you, sir.
We have Karandikar ji, second participant.
Yes.
Karandikar ji, are you
Mrs.
available?
Karandikar? Mrs. Karandikar ma'am is there?
Yes, she is there.
Okay.
You are not audible. Unmute yourself. Madam, unmute yourself.
Yes.
Okay.
Yes. Now we want to see you, your beautiful face.
Yes.
So Manik Karandikar ji is a very affectionate person who was coming to us for her severe osteoarthritis, and how she was helped by our approach, our rope and belt therapy approach, and her willpower, and again consistency. Satu Dirgha Kala Nairantarya. Let us hear from her. Yes, Manik ji.
Yes. Thank you, Dr. Ketkar. मी मराठीत बोलले तर चालणार आहे?
हिंदीत राष्ट्रभाषा का प्रयोग करें.
दोनों both में mix कर रही हूँ. Okay.
Okay.
I am 70 years old. I am sharing my experience जीनोसिस से. रोप एंड बेल्ट थेरेपी जब मैंने शुरुआत की, मैं 2018 में मैं जब मेरी बहुत ही सीवियर कंडीशन हो गई थी कि मैं बेड से नीचे नहीं उतर पाई थी और मैं चल नहीं सकती थी. उस टाइम जब मैंने डॉक्टर केतकर का खाली नाम सुना था, लेकिन मुझे कुछ मालूम ही नहीं था. तब मैंने फोन किया उनको और बताया कि मेरी बहुत ही सीवियर कंडीशन है और मैं चल नहीं पा रही हूँ और मुझे आपके यहाँ आना है. तो उनको कहाँ जाने का था, अर्जेंट जाने का था, मीटिंग वगैरह थी, लेकिन डॉक्टर केतकर मेरे लिए वहाँ रुकी और मेरी हालत देख के वो नीचे खुद आई और उन्होंने मुझे चेक किया. वहाँ ही उसके साथ जूली मैडम भी थी और उन्होंने क्या किया कि वो रोप्स मुझे बांध दिए थे और वो रोप्स जो थे तो उस 2 मिनट में ही मुझे एक थोड़ा सा आराम मिला था. और उन्होंने बताया कि आजकल छुट्टी है, लेकिन सोमवार से आपको ज्वाइन करना है. तो मैंने बोला कि सोमवार से ज्वाइन करना है तो कैसे करने का, क्योंकि मैं तो सीढ़ियाँ उतर ही नहीं पा रही हूँ और चढ़ भी नहीं पा रही हूँ. तो उन्होंने बताया कि कुछ नहीं, आप आ जाओ और हम लोग केयर लेंगे. और वैसे ही पहले 4 या 5 मंथ्स मैं वहाँ आते समय वहाँ बताती थी कि मैं आई हूँ नीचे, और कोई ना कोई मुझे ऊपर लेकर जा रहे थे. और सब होने के बाद, थेरेपी होने के बाद, कोई ना कोई मुझे नीचे छोड़ने तक या रिक्शा तक लाने मुझे हेल्प करते थे. लेकिन और जब मैंने शुरुआत की तो मेरा बहुत ही सीवियर कंडीशन थी और L4 L5 वो जो एक गैप थी और S1, तो मुझे बहुत ही तकलीफ हो रही थी. तो उस टाइम उन्होंने मुझे एक करेज दिया, बताया कि क्या है मेरी क्या तकलीफ है, और वो रोप्स और बेल्ट्स उन्होंने मुझे सिखाया भी. और उनके जो बाकी सब जो ट्रेनिंग है वो सब उन्होंने भी मुझे बहुत हेल्प की. और एक 3-4 महीने के बाद जब मुझे थोड़ा थोड़ा आराम मिलने लगा। इसमें कंसिस्टेंसी बहुत ही इम्पोर्टेंट है। ऐसा नहीं है कि 15 दिन 1 महीना देख लो कैसा आपको हो रहा है और बाद में सोचना कि आना है या नहीं आना है, वैसा नहीं है। ये जो है, ये जो थेरेपी है, कहाँ भी जाओ आपको कंसिस्टेंसी जरूरत है। जितना कंसिस्टेंट आप वहां पे ध्यान दोगे और खुद पे प्यार करना है, यानी कि मैंने समझ लिया कि ये थेरेपी क्या है, मेरी क्या तकलीफ है और मुझे कहाँ पे फोकस करने का है। और उस प्रकार से मैंने सीख लिया ये सब। और उसमें उन्होंने जो जो बताया, कुछ व्यायाम एक्सरसाइज भी बताए उन्होंने। और उनमें एक पादांगुष्ठासन था, वो मुझे बहुत ही डर लगता था, लेकिन उन्होंने प्यार से समझाया कि ये पादांगुष्ठासन का मतलब उसकी खासियत क्या है, मेरे नीज में जो गैप है तो वो सब ठीक हो जाएगी, वहां से वो ब्लड सर्कुलेशन ठीक से वो शुरू हो जाएगा, ऑयलिंग ग्रीजिंग होगा। तो वैसा ही मैं महसूस करने लगी थी। तो एक 3-4 महीने के बाद, यानी कि 6 मंथ्स तक तो मैं बहुत ही अच्छी तरह से चल पाती थी और सीढ़ियां भी चढ़ना उतरना मैं खुद करती थी। और उसमें मैं ये जो रोप एंड बेल्ट थेरेपी है, तो ये इसमें जो मेरी जो नीज में जो गैप है, हाँ, तो वो मेरा जो लेग, वो शीन बोन, वहां पे बो आया था, बो टाइप हो गया था, तो वो ठीक हो गया। और अलाइनमेंट जो थी मेरी बोन्स की, वो सब ऐसे बिगड़ गई थी। तो अलाइनमेंट ये रोप से बहुत बहुत ठीक तरह से मेरी अलाइनमेंट सुधर गई। और मेरी तो सीवियर केस थी, ऑपरेशन की ही केस थी, लेकिन मैं ऑपरेशन मेरा टल गया। और 2018-19 और जब मैं वहां पे आती थी, जब काजरे सर ने जैसे बताया, तो आगे आगे से तो मेरा ऐसा मेरे जो स्थिति है वो मेंटेन कर रही थी मैं, ऐसा ही मुझे लग रहा था। सब फैमिली जैसा एटमॉस्फेयर वहाँ सेंटर पे है और सब मिलजुल के सब काम करते हैं और बहुत लगाव है उन सभी के काम में। ओके, तो ये जब लॉकडाउन हो गया तो मैंने तो बहुत ही मिस किया, सेंटर सब कुछ बंद हो गया था। फिर भी वो जो मैंने कमाया था, यानी कि 1 बरस तो मैं आ रही थी वहां पे सेंटर पे, लॉकडाउन की वजह से आना बंद हो गया। फिर भी जैसा बैंक बैलेंस रहता है उसके ऊपर इंटरेस्ट रहता है, उसी प्रकार से वो जो वही इंटरेस्ट पे मैं आज तक, यानी कि 2022 अभी शुरू हुआ है, लेकिन मुझे उसका फायदा मिल गया है। और मेरा अभी ऑपरेशन वगैरह सब पीछे पड़ गया है। और मैं घर पे अभी थोड़ा बहुत एक्सरसाइज वगैरह करती हूँ। अब जब सब ठीक हो जाएगा परिस्थिति, तो मैं क्या पता मैं फिर से सेंटर पे आऊंगी इसलिए कि वहाँ एक फैमिली जैसा सब एटमॉस्फेयर है, सब लोग एक दूसरे से बहुत अच्छी तरह से लगाव है। और ये यानी कि बाहर आना वो भी हो जाता है, मेंटेनेंस हो जाता है, फिटनेस अच्छी तरह से हो जाता है। और सब डॉक्टर केतकर, उन्होंने मुझे बहुत अच्छा सिखाया, बताया। उनके जो प्रणीता है, कस्तूरी है, जूली मैडम है, ये उन्होंने सब मुझे कैसा करने का है ये सब बताया है, केतकी मैडम थी। और उसी रोप से और बेल्ट से अभी मेरा काम चल रहा है। तो मुझे ये कहना है कि ये थेरेपी बहुत ही उपयुक्त है, बहुत ही उपयुक्त है। एक बार जरूर इसका अवलंब करना है, तो सभी को इससे फायदा जरूर हो जाएगा। और ये अपने जो पहचान वाले हैं उन्होंने भी ये बता देना है कि ये क्या थेरेपी है। सो आई मस्ट से थैंक्स टू डॉक्टर केतकर एंड उनका सब स्टाफ। और अगेन थैंक यू वेरी मच कि मुझे बोलने के लिए अवसर दिया। Thanks a lot. Thanks a lot.
Thank you, Karandikar madam. Thank you. It's very nice of you to narrate your experience. And somebody was asking question to Karandikar madam that if the rope and belt therapy is helping you, for how much duration it should be given, and if the patient is feeling better and patient is learning, what is the role of therapist? So I will like to answer this question. That our approach is based on three principles. One is classical modified yogic postures which are taught to patient. Second is ambulatory belts which are taught to patients, which patients are supposed to learn by the belts and use them in their day-to-day life. And third is rope and belt therapy, which is given at center. So for mild cases, usually 1 month to 2 months are sufficient. For moderate cases, in case of ONE, we grade them according to Kellgren classification. Grade 0 to grade 1 is mild, grade 2 is moderate, and grade 3, early grade 3 is severe. So for rope and belt therapy is required for 1 or 2 months for mild, 3 to 4 months for moderate, and 4 to 6 months for severe. And once this is given and patient learns the ambulatory belts which are to be used in day-to-day life and masters the yogic postures which are therapeutic modified postures, then patient doesn't have to come to center at all. So coming to center for rope and belt therapy may be for 2 months or 4 months or 6 months, that's it. But you have to adhere to the ambulatory belts whenever the pain comes, and later on even the ambulatory belts are not required. You have to adhere to the phase 1, phase 2 class modified yogic postures. So I hope I have answered the question that rope and belt therapy offers passive correction, and that's why it relieves pain and stiffness pretty early, predictable, right? Now second question was, is English language required for the course? Rope and belt therapy course is conducted totally in English. So knowing English will be important. Of course, we will help you and we can talk in Hindi or in Marathi if required. But the whole study material is in English and the basic medium of the course is also English. However, language is not the bar. Language is not the hurdle. Your understanding is important. Your awareness is important, and your will, wish, and desire to help the people, to help the society is important. So it goes beyond the limits of language. Don't worry about the language. Learn the principles. Yes, sir.
Thank you, ma'am. Now we wish to have opinion from some doctors.
Okay.
Apart from you, that who did the RBT course and how they are using this RBT practice in their day-to-day life.
Okay.
So we have, I think, Dr. Manisha Khareji.
Yes. Yes, Manisha Khareji.
Manisha Khareji, are you available?
Yes, yes, I am there.
Welcome.
Yes. Okay. Yeah. Hello. Good evening, everyone. And it's really glad to share my experience on this platform because this journey started right in 2008-9. And before that, I will just introduce you my journey. Like before that, I was learning yoga in a very renowned institute in Pune for 6 years. There I could learn it for myself, but so I could learn how to do the asana, and that is for myself. And there was a shortcoming that I couldn't convey the same things to other because I was not knowing what not to give and why not to give. And if this asana not to give, then what else to be given? You know, so all those queries were there. And when I read about Dr. Vineeta Ketkar madam's course about medical yoga therapy for doctors, and that was a 1-year course that time. So that got me inspired and I started with the course, and the learning anatomy and physiology again with the perspective of yogic science was really an enlightening feeling. And it was like, you know, that missing links कि कोई भी आसन अगर हम करते हैं तो वो कैसे करने का हम सीख गए थे, लेकिन वो वैसा क्यों करने का, like even in simple tadasan, why to extend the pelvis, why to suck the kneecaps, why to keep the feet parallel, many small things, but that why got answered by learning anatomy and its application. And that was a very aha moment for me during the course. So So that kept the interest on, and also simultaneously the practice was going on. So firstly, the application on oneself. So we used to practice in the center, एक दूसरे को हम belts ropes बांधते थे, and then फिर वो जो एक means जैसे low back होता है पुणे में, you ride on two-wheeler so much, road conditions so वो पहले खुद पे जो एक relief का feeling आता है ना, तो उससे हमारा confidence और भी बढ़ता है. तो जानना और एक्सपीरियंस करना में काफी गैप होती है, और जैसे आप खुद एक्सपीरियंस करते हो कोई भी थेरेपी का इफेक्ट, तो आपका कॉन्फिडेंस बहुत बढ़ता है, एंड विद दैट कॉन्फिडेंस यू कैन हेल्प सो मेनी पीपल अराउंड यू. सो व्हेन इन द प्रैक्टिस आल्सो, देन the diagnosis skill also improved with this education of medical yoga therapy in the course. एंड फिर जैसे कि ना पेशेंट्स जो आते हैं वो पैकेजेस में आते हैं, सिर्फ हमारा वो पैथोलॉजी वगैरह सब पैकेजेस में, हॉस्पिटल पैकेजेस नहीं रहता. पेशेंट भी कंडीशंस के पैकेजेस के साथ आते हैं कि मस्कुलोस्केलेटल डिसऑर्डर है, डायबिटीज है, हाइपरटेंशन है, ऐसा सब खिचड़ी करके होता है. सो उसमें along with the medication, what we can give for the faster relief is the medical yoga therapy. And I don't have the classes, yoga classes, but at clinical level also I can help them to understand with the at-home postures which madam has designed. Phase 1, phase 1, phase 2 with the proper stretching first, and then the strengthening of selected group of muscles around the joints. So वो जो एक समझ आती है ना, तो उससे, क्योंकि nowadays the yoga class is there, गलो गली है वो, और like you not the every yoga class teacher is so well equipped to handle such cases where some conditions are there. So अगर वो कहीं से आते हैं तो हमें पता होता है कि वो कर रहे हैं, वो ठीक कर रहे हैं या नहीं कर रहे हैं, और अगर नहीं कर रहे हैं then we know how to rectify it or what to advise it to them. So उसका practice में काफी ज्यादा help होती है. This is one thing. And the another thing, just my experience, I just want to tell you, like my left knee is little weak because वो स्कूटी पे ना बहुत 6 साल तक लेफ्ट लेग से मैं किक मारती थी सीट पे बैठ के, और फिर वो मेरा लेफ्ट नी थोड़ा बीच बीच में तकलीफ देता है. सो जब हम वो मोबिलाइजर्स बांधते हैं ना नी के घर में, तो हमारी चाल सुधर जाती है. यू डेफिनेटली कम टू नो द डिफरेंस बिटवीन योर व्हेन यू आर वॉकिंग लाइक विदाउट मोबिलाइजर्स एंड विथ मोबिलाइजर्स. तो यू लाइक रियलाइज कि आपका जो वेट बेरिंग एक्सिस वो जो डिस्टर्ब हो गया है ना, वो करेक्ट हो जाता है जैसे आप बेल्ट्स वो प्रॉपरली टाई करते हो तो, और उसके साथ अगर आप चलते हो तो you immediately get the relief from the pain. So that is my experience. And also of course it helps me in the clinical practice, but then the second way it helped me was I could conduct the workshops, medical yoga, not medical yoga, but the office yoga workshops in corporates with this knowledge. And then in National Insurance Academy also almost 7 times they invited me to conduct the chair yoga, like office yoga. Once we took over there and they liked it, so every time they used to call us. So वो ऑफिस योगा में चेयर में बैठ के, बिकॉज सो मेनी पीपल दे ऑल हैव दिस डेस्क जॉब एंड स्क्रीन रहता है सामने, एंड नो वन हैज अ करेक्ट पोस्चर. सो लेकिन वो रॉन्ग क्या है और उसको रेक्टिफाई कैसे करना है, और ऑफिस में बैठ के ही जो स्ट्रेन आता है आपके नेक के ऊपर, लो बैक के ऊपर, तो वो कैसे आप वही के वही नलीफाई कर सकते हो इन सिंपल 5 मिनट्स के एक स्मॉल सेशंस आप अगर उनको सिखाते हो तो बहुत वो यूजफुल रहता है, और उसका कई लोगों को एडवांटेज मिला है. देन दिस एट होम जो हम पोस्चर्स, योगा पोस्चर्स बताते हैं, वो दिखने में ना काफी सिंपल लगते हैं. लाइक एक गायनेकोलॉजिस्ट थी जिसको मैं होम विजिट के लिए जाती थी, उसको नेक सर्वाइकल प्रॉब्लम्स थे इसलिए, तो फर्स्ट डे पे शी थॉट ओ इट्स सो इजी, बट देन सेकंड डे व्हेन आई वेंट अगेन, देन शी टोल्ड मी कि हाँ मुझे करते टाइम लगा था कि बहुत इजी है, बट देन आई रियलाइज्ड, और मुझे पूरे दिन लगता रहा कि मैंने कुछ काम किया है वहां पे और मेरा कुछ तो पॉजिटिवली शिफ्ट हुआ है. So that is the main beauty of these looking simple but very effective at home techniques also. and I am really blessed with this medical yoga therapy as additional knowledge, and which I can use for myself and also help for so many people around. So thank you so much, and thank you for giving me this opportunity.
Yes, Dr. Manisha, she is a MD homeopath and practicing in Karve Nagar, very prime location of Pune. It's a cream location of Pune, and she has a very dashing practice, and she, you know, she is having a dashing personality as well. So she is a brand ambassador, and she has done the course when the course was conducted for 1 year. She belongs to that generation. At that time, initially 5-6 years, still we left Hardikar Hospital. This course, which is comprising for 4 months, was conducted for 1 year. And now Manisha just wonders that how we were coming to Hardikar Hospital for 1 year. Now it is unimaginable.
Yes.
But these students never missed a single day of the course. I mean, there was such a like it was like a magnet connection with us, and with the situation, with the understanding, with education. And Manisha, next time, please visit Ghanshyamji's center in Borivali.
Yes,
And
of course.
let us extend a
My
hand to
pleasure.
him, and will help the patients. Definitely.
Madam, just can I add one more thing
Yes,
in this?
yes, yes.
Like along with my practice, I'm also like running one more vertical of healthy weight management, because the weight is a major issue nowadays in the society, and that is also contributing factors for faster degeneration of knee joint or lower lumbar spine. But unfortunately, these people are not capable of like going for the regular exercise like walk or run or so this at home yoga postures are helping me to give the exercise, so they are getting the satisfaction that they are doing the exercise. Simultaneously, whatever the disorders they have, they get rectified, and also they start losing the weight, and then they slowly start walking also.
Wonderful.
So there also it is helping me a lot. So thank you so much.
Wonderful, Manisha. And Ghanshyamji, agle time, please call Dr. Manisha.
Yeah. We
Yes.
are now
Pleasure,
part.
my
We are
pleasure.
part of
Yes.
the Gnosis family.
Yes, yes.
Yes, thank
Okay.
you.
Dr. Archana ji, are you available? Archana.
Yes, yes.
Okay.
Yes,
welcome,
I'm
welcome.
also available here. Yes. Hello, everyone. Good morning. Good evening, ma'am.
Yes, good evening. Dr. Archana is pure Ayurvedic consultant, and she is practicing Ayurvedic consultant with her Panchakarma activity as well. Another dashing personality, and she talks like she's shooting the gun. So now listen to her. Yes, Archana.
No, it's not like that. Sir, can you please allow me to share the screen?
Yeah, sure.
Yeah, thank you. Because till now, all of you have listened that from the patients, even from the doctors, I will like to elaborate one of my cases. Okay, so that will be better.
Vineeta, possible for you to make her co-host, Archana?
She's already made co-host.
Okay, thank you.
Just a second.
Visible.
Okay. Slideshow. Just a minute, I'll make a slideshow so that you can see the PPTs entirely. So I'm running this Swastik Medical Yoga Center at Kothur area, in the Kothur area basically. So first of all, Happy New Year to all of you. Now I have done this course at Madam's place at Gnosis, Shivaji Nagar in 2018 and 17. I have just kept the certificate also. Later on, I have done the Yoga Certification Board, Yoga Therapy Consultant also. Here is my banner basic, Swastik Medical Yoga, a brief banner so that patient can very well understand that what exactly we are doing and for what we are treating them. So all of we are from yoga background. I specifically mention it yoga. Madam also says it's not yoga, it's yoga. It's akaranta ending with a. Oh, so we all know this, that it is self-awareness program. Okay, and now my tribute to all of them, because they have introduced this yoga science as in therapy. So even for therapeutic person, musculoskeletal system, bone disorders, arthritis, even the psychological problems, not only the yogic postures, no, not merely the asanas, but pranayam, dharana, shuddhi kriya, all are being used as a therapy, which is helping lot many patients really indeed. Okay, so here I have just demonstrated one Suptabadha Konasana. We are all doing this. This is the classic posture on the left side. And you can see it is well modified with bolsters and pillows and everything. So now I can hold this posture for 10 minutes with ease. There is no problem for me to hold this posture for 10 minutes and I can get all the benefits of this posture. Similarly, once you learn this course, basically you understand how to modify the asana. Basically, what's the importance? As Manisha told you, you just understand what group of muscles you are using, exactly the why, in between why not to do, how to do. So you can very well modify these asanas. So you can see this Ashvasanchalanasana, the spine should be kept straight. That's the basic of this Ashvasanchalanasana. So you can modify it with any of the props you have at home. So that's very important and you understand it very easily, that how you can modify. You don't have to rely on anybody. How to do this? ये मैं कैसा करूँ? अभी कैसे बनाऊँ? ये किसको कैसे prop बनाऊँ? Use करूँ? You don't need to do these things. You can absolutely define yourself. Okay. So now here is one of my cases. She is a 73-year-old female. Okay, she is known hypertensive. As Manisha rightly said, we always get the patients in complaints of packages. Okay, so you don't get only the problem, you get a package of problems. So she is 73 years old female. She is hypertensive for last 15 to 20 years. She is diabetic for last 10 years. She came to me with severe lumbar pain, left leg pain for 2 to 3 months. She was not able to sit or stand even for 5 minutes. Even a meal, lunch or dinner is a task for her. Okay. So in this case, she has been there. She has consulted the spine surgeon also. As on, spine surgeon has recommended her to go for operative, given some muscle relaxants and sometimes pregabalins and something, and asked her for go for 10 days and then better to go for operation. Okay, so when I examined her, so this was left leg SLR positive. Those who are doctors out of you can very well understand this. But definitely there was no tingling numbness. That means the neurological deficit was not there. She was not able to stand on, means weight bearing was not possible for her. She was not able to stand even for 5 minutes. So in my mind, considering her age, I thought of osteoporosis, and to just check down, I have asked her to do the hip joint, bilateral hip joint X-rays, so that there should not be any fracture of the hip joint or anything like that. So basically, you get complete awareness that exactly what are the parameters that you should look for before going for RBT. So it is very important that you should not go for any under any false impression कि आप कुछ भी ठीक कर सकते हो, ऐसा नहीं है. There are protocols and you have been taught with those protocols, so you can very well think accordingly and you can go along with that. So this is our MRI report. So you can see that ligament flavum thickening at all the levels from L1 to L5. So that was the basic problem, and that was creating even the scoliosis, mild scoliosis, and that's why you can see her photograph. She is slightly tilted. She is not standing straight. She was not able to stand straight actually. So then, as madam taught us, they say there are basically for any medical yoga therapy, there are basic 5 R's, that resolve, reverse, restore, rejuvenate, and regenerate. So we go with this protocol and we treat the patient with these protocols. So first was resolving. So it was analyzing. The analysis depends upon age, sex, everything, personality, nutritional status, even the psychological trauma, if anybody has. Then while treating this patient, what are the key points for me? So first important was the reducing weight, especially the abdominal girth. For that, I have given her awareness about the dietary modifications, portion eatings. Second thing, what important I have done is given assurance that this can help her for a better living or independent living. So with God's grace and with Madam's blessing, I am definitely have a spine surgeon also in my contact, and he also is very much impressed with this treatment. Even I have given ma'am's book also to him, so that he's really very much, because many a times the surgeons and doctors are not aware exactly what yogic therapies are going on. So I approached him, I've talked with him, I have shown him slides, he has visited my center. So similarly, I have talked with him all again, and both of us have decided that let's treat this patient conservatively with RBT. And then the second thing was reverse. So identifying the precipitating factors, why the pain is there. So considering this, then I have taught her about the postural awareness, how she should sit, why she should avoid the soft sofas, the spring-loaded sofas, the uneven mattresses, the uneven beds. Because whenever patient is going for yoga therapy or patient is going for any therapy, what first thing is they are coming to us for 1 hour or max 1.5 hours. Rest of the day they are at home. So I feel personally it is very important that they should be aware of what they should do for rest of the day. So that was one thing I've made her aware of all these things, that avoiding the soft sofas especially because they create a lot of lumbar problems. Then second thing was, in her case particularly, constipation was a major aggravating factor. Whenever the constipation is there, the pain also increases. So I have asked accordingly dietary changes to her. Then whenever required, I have given Basti treatment, which is Ayurvedic classic treatment part. I have given her, and she used to take it at home. That also helped very much. Then the third most important part, what we are listening for the last hour, is the restoration. So here at Gnosis, basically, Madam teaches us the restoration in basic 2 ways. Yes?
Yes, continue.
Okay. So first is RBT, what we have learned. Okay. So in RBT, how exactly RBT helps is basic correction and restoration at all these levels. Now, this case is particularly of lumbar spine. So I am addressing this. Okay. The facet joints, intervertebral discs, muscles, ligaments, and to their highest efficacy. Because as the age advances, my case is of 73 years old. Okay, so degeneration will be there, no doubt about it. Okay, after say for 50s, 60s, you get the patients of degeneration, especially in ladies. We get it with menopause, aggravated degeneration, osteoporosis, all these. So treatment is always individualized. First, it is there for palliation, because the pain is the main concern what the patient is coming for, pain and stiffness. Okay, so accordingly, RBT is planned like that. Then second thing is, the second sequence is at home, as Madam told us. At home exercises, ambulatory belts, and RBT. On 3, and this tripod, we treat the patient. So first is RBT that we go at the center. Then second is yogasanas, which are taught to be done at home. They are definitely modified and well classified. Okay. So there are some regular poses of it, like Pavan Muktasan and Gomukhasan in lying down posture, which help to stretch and strengthen the particular group of muscles, which are being in spasms and creating the pains and stiffnesses. Now, along with this RBT and at home exercises, the third most important, what yoga science teaches us, is the breathing awareness. It's not only awareness, but it is the conscious relaxation. which definitely helps at the psychological levels, the sympathetic, parasympathetic levels, and reduces the anxiety. In turn, which relieves the muscle spasms. And that gives a great relief to the patient. Definitely, with all these three parameters, with the patient, we built a functional fitness. As Kazare sir also said, Karandikar madam also said, we built a functional fitness that they are able to do the day-to-day activities well without pain. And second important thing is self-sustainable model. Somebody was asking that patient are doing the RPTs of their own. Definitely not exactly the RBTs, but ambulatory belts are always helpful for them as a self-sustainable model. They are not totally dependent on you all the time. They know how to treat themselves and how to use the ambulatory belts. So this is one stretch, what is classically called as double rope pelvic lift. I've given this diagram. She is the same lady. Many other stretches was also there, but this is what I have used as a photograph. Okay, so this was given primarily to her. The treatment duration was approximately 3 months. She was there in March, April, and May. It was a highly period of lockdown and everything, but I was conducting with the patients on one-to-one basis, and of course, definitely excluding weekends. So now, after May 21st, she is in contact with me almost for every month. She is reporting me every month. So now 7-8 months are over now. Definitely. The patient is doing all her scheduled program twice or thrice in a day. What program I mean to say, at home exercises. I have given her, just like medical prescription, I have prescribed her different yoga postures, at home postures, and she is practicing them twice or thrice in a day. She is very happy because since March 21, she has not required a single painkiller, what we call anti-inflammatory drugs, during these days. Okay, she can very well carry out her daily activities easily. She can go with moderate cooking activities. She can attend the family dinners, and even she can go for a day outing with her relatives and everything, because she has the ambulatory belts with her and she know exactly how she should keep her posture in any situation. So that helps her not get to back again to the worsening situations. The rest two parts of the R's were rejuvenation and regeneration. Now, considering her age, 73, definitely regeneration will be a slow down process, but still it is an ongoing process. So I have given her modified yogic postures, at home posture, postural awareness. This basic at home exercises, they always help the patient to keep the balance between anterior, posterior, lateral group of muscles. Because as we all know, samatva is yoga uchyate. It is a balance between everything, a balance between your even anterior, posterior muscular group. Similarly, dietary changes also I have advised her according to Ayurveda, so that it will help for rejuvenation and regeneration. So thanks everyone for patient hearing basically. And definitely I am very much happy with her. She is also happy with all of us. And I'm really thankful because I have done this course. I am able to treat a patient. It's a great satisfaction as being a doctor that you are, maybe you may not be able to cure the patient, but the patient is functionally independent, functionally fit. And she is so happy that really every month she herself calls me, Archana, me ekdam chhan aahe, and I am doing very well with your treatment. So that's really nice. And being a doctor, really, Manisha has said that you understand the basic whys, that why we are doing this and how we should do this. So really, thanks all of you. And thank you, madam.
Wonderful, Archana. Archana has given a mini lecture. So very good, Archana. It was, you have the idea, the glimpse of the course now, which Arjuna has given. And Arjuna, it was a good presentation, very nice.
Thank you, madam.
And now Ghanshyam ji, आप
Okay,
देखिए
thank you, thank you.
कि हमारा succession plan ready है. God has
Yeah,
planned in the form of Dr. Kanwal, Dr. Manisha, Dr. Archana. So thank
Yeah,
you for the
wonderful,
succession
wonderful.
plan. Yes.
Very
yes,
nice.
Yes.
Okay, now we will have one participant, Parul Bhuta.
Okay.
Parul, are you available? Parul is a very smart yoga teacher.
Right.
She thought that before joining the course, let me join as a patient and see. She is a yoga teacher, very much interested in the knowledge part. Everywhere she collects a lot of knowledge. But here she did before she joining the course, but before that she joined as a one of the, I don't know whether she is having back pain or not, but to see the clinical effect of RBT.
Okay.
So I request Parul to share her experience. Parul, you are audible.
Sir. Namaste everyone.
Namaste.
So, ma'am, I met you once. Consultant के लिए आई थी. Back pain naturally था. But now after your recommendation के 1 month का आपने दिया था जो course, काफी relief है. Back pain is not there. But the problem was मेरा spine is not aligned. I have a lordosis problem. So मुझे वो I want to correct that posture.
Okay.
So I wanted to know कि हाँ, okay, क्या हो रहा है, कैसे हो रहा है, and मेरे को no doubt काफी फर्क लग रहा है अभी, and about the arbitrary जो मुझे traction दिया जा रहा है जो, so I feel the space in lumbar area.
Very good.
And वो भी समझ में आ रहा है कि वो rotation हो रहा है legs का, so it is really intense rotation, and this traction give me a good relief.
Good. So Parul, that is the story, that you have to understand what are the changes occurring in your body. बैठे बैठे क्या होता है अल्फा S1 में, and exactly opposite हमें क्या करना है. So what Dr. Karandikar used to say, yoga is opposite of bhoga. So भोग यानी डे टू डे एक्टिविटी में जो होता है उसके बिल्कुल रिवर्स दिशा में अगर हमें करेक्शन करना है तो कॉम्प्रेशन होता है बैठे बैठे, और हमें करना है डिस्ट्रैक्शन जो आपने कहा. And even I have listened to Dr. Jaydev Panchavag, who is a famous spine surgeon of Pune. He said yoga has the power of inner distraction. So inside distraction आपको अगर feel हो रहा है, so that is what matters. So Parul, good. So when you are taking, even if it is passive correction, that's what we say, that in passive correction, rope and belt therapy is offering passive correction. लेकिन वो passive होते हुए भी अगर patient का ध्यान उसमें रहा तो patient के समझ में आता है कि मेरे बदन में क्या हो रहा है. Yes, मेरा lordosis बढ़ा है या loss था और अभी restore हो रहा है कि normal हो रहा है. ये सब जानकारी लेना एक बहुत interesting journey जो होता है. Good Parul, good.
Thank you.
Yes.
Thank you. I request also quickly Erita to share her experience. Erita is another participant who is joining the course.
Good.
Namaste again, everyone. Just very quickly, so one of the reasons that I want to join is because for years now, almost about 8 or 9 years, I've had a lower back problem. So I've had chronic pain, and it's just gotten worse over the years. And compounded by the fact that I've had a sitting job, it's become worse and worse over the years. So that's when I got into yoga, and so helped me quite a lot. Like I can't tell you how much. And got into the yoga therapy aspect. So this for me is the very next logical step. And like Parul, I think this would work more for me first. And a lot of the people that we work with as well, like low back pain and knee problems are very, very common, rampant among people of all age groups nowadays. So this is something that I would like to learn for myself first, and then be able to help people around as well. A lot of the patients that we work with. And the third reason that just came up today, I mean, I came with two main reasons, but the third reason is listening to everyone. I think I'm even more convinced about my decision to, participate in this course.
Great, Erita, great. So welcome. Welcome for your learning desire, and that is what is called jigyasa. So that is really appreciated. And of course, the wish to help the society. Yes.
Thank you so
Yeah,
much.
Erita is a madam very special case. When she joined, she had pain all over the body,
Okay.
and a lot of this pain is taking her mental energy down.
I know.
And really, it was a very difficult, and it was relapsing again and again.
Oh.
And relapsing. And now I just now I remember I never asked you, Erita, in last many months, how is your pain now?
Because her radiant face is sure is absolutely great. Absolutely great. Yes, yes.
So thank you.
Yes.
Thank you, Erita. I will give you a little bit about the course details. The course will be conducted by Gnosis only, and it will be a online course followed by offline training at our Borivali Center. So, the course will be conducted in part 1 and part 2. Part 1 is a called as preparatory workshop for the RBT. RBT will start from 24th of January, and preparatory workshop by Dr. Kaval will take this workshop. This workshop is basically what is required to know about RBT will be provided in this preparatory workshop, which will start from 17th of January. So the course will be conducted 9 a.m. to 11 a.m. 9 to 10 will be the theory, and 10 to 11 will be the practical. Practical, you have choice of online, but offline you have to come and learn the practical aspect at the Mumbai Center based at Borivali. We are based at Prana Yoga Therapy Center is based at Borivali. So practical training is must, and I make it very clear that even after completion of the course, we have made at least 1 month of internship compulsory.
Yes.
You have to come and work with us, work with the patients, and you have to master, because this I have seen it cannot be mastered online. So offline touch is required. Full RBT course, which covers part 1 preparatory workshop, then RBT module for cervical neck pain, RBT module for low back pain, and RBT module for knee pain, and RBT module for sciatica. So these are the 4 modules will be covered along with the preparatory workshop. This is what the format and protocol for the workshops. It will start on 17th of January, and the course will end on 31st of March, followed by 1 month of internship.
Yes. One thing in addition, sir, daily Zoom recordings will be sent to you.
Yes.
For one.
Correct.
Before that, the study material will be sent to you in PDF format, which you are supposed to keep ready with you, because we make students to read while teaching the theory. That is second one. And the third one is you are sent videos of a whole RBT everyday basis. So you are having 3 supports. One is the study material, second is Zoom recordings, and third is the videos. But in addition, of course, internship, doing internship, hands-on experience, फिर अभिषेक के हाथ जैसी जादू आपके हाथ में आएगी, and for that you have to go to Prana Yoga and practice. Yes.
So I request everyone, please at least we have Erida will provide you the GPay number. She will provide you bank details. This thing. Please, we are taking only 10 participants, and out of the 10, the 6 participants have already confirmed. So we have only 4 seats available. So if you are interested, please get in touch with Erita, or please register for this thing. I appreciate Darshana's effort. Darshana is joining this course from Nasik.
Oh, great.
So
great.
I asked Darshana, how will you manage? She said, don't worry, I will manage.
Wow, very good. Very good. Very good.
So welcome, Darshana. And so we end up session. Thank you, madam. Thank you, the Gnosis team.
Another thing, Ghanshyamji,
yes,
that please let everybody know that we are conducting consultation on Zoom.
Correct.
For the patients who are coming to Ghanshyamji for last 1 month. And almost because of that consultation, about 10 to 15 patients have already joined Ghanshyamji at Prana Yoga Center and have started RBT. So
I just
there is
share.
no hurdle. There is no hurdle.
I just share one of the patient at the age of 62 came with a knee pain. Jayashri Ben
Yes.
Magaria. You know, we have not started RBT. I just gave her the home care program.
Yes.
And today this patient is telling everybody that my 80% pain is gone.
That's gone.
Only with home care program. No
Yes,
RBT we have
Yes.
started.
Yes.
Huh?
Yes. Yes.
So this is the, you can say, not magic of me. This is the magic of RBT I have seen.
Yes. Yes. Yes.
So thank you everyone for this wonderful evening, and thank you for the Gnosis team for making us this meeting orientation very successful, and looking forward to meet you during the RBT course.
Yes.
Om Namah Shivaya. Om Purnamada Purnamidam Purnat Purnamudachyate Purnasya Purnamadaya Purnameva Vasishyate. Om Shanti Shanti Shanti. Thank you everyone.
Hari Om.